Geneva. Welcome to our COVID-19 press briefing today, this Monday, July 20. As usual, we'll be providing simultaneous translation in all 6 languages, all 6 UN languages, plus Portuguese, and you may also listen in Hindi. Note, owing to the way Zoom is set up, you will have to go to the button marked Korean to access Arabic. We have been having some connectivity problems today, so we apologize if there are any problems. We will ensure that we keep it going on Zoom, but there may be some problems with our social media connection. And now I will hand over to Dr. Tedros. Dr. Tedros, you have the floor.
Thank you. Thank you, Margaret. Good morning, good afternoon, and good evening. Although people of all walks of life are affected by COVID-19, the world's poorest and most vulnerable people are especially at risk. That's true of indigenous peoples all over the world, in urban or remote areas. There are up to 500 million indigenous peoples worldwide in over 90 countries. Indigenous peoples have unique cultures and languages and keep deep relationships with the environment. Like other vulnerable groups, indigenous peoples face many challenges. This includes a lack of political representation, economic marginalization, and lack of access to health, education, and social services. Indigenous peoples often have a high burden of poverty, unemployment, malnutrition, and both communicable and non-communicable diseases, making them more vulnerable to COVID-19 and its severe outcomes. Although COVID-19 is a risk for all indigenous peoples globally, WHO is deeply concerned about the impact of the virus on indigenous peoples in the Americas, which remains the current epicenter of the pandemic. As of the 6th of July, more than 70,000 cases have been reported among indigenous peoples in the Americas and more than 2,000 deaths. Most recently, at least 6 cases have been reported among the Nahua people who live in Peruvian Amazon. WHO's Regional Office for the Americas recently published recommendations for preventing and responding to COVID-19 among indigenous peoples. The WHO is also working with the coordinator of indigenous organizations of the Amazon River Basin to step up the fight against COVID-19. One of the key tools for suppressing transmission in indigenous communities and all communities is contact tracing. No country can get control of its epidemic if it doesn't know where the virus is. As we have said many times, so-called lockdown measures can help to reduce transmission, but they cannot completely stop it. Contact tracing is essential for finding and isolating cases and identifying and quarantining their contacts. Mobile applications can support contact tracing, but nothing replaces boots on the ground, trained workers going door to door to find cases and contacts and break the chains of transmission. Contact tracing is essential for every country in every situation. It can prevent individual cases from becoming clusters and clusters turning into community transmission. Even countries with community transmission can make progress by breaking down their epidemics into manageable parts. This is all the more critical as countries are opening up. Reacting rapidly to new cases and clusters will allow countries to continue on the road to economic recovery while keeping the virus at bay. Of course, contact tracing is not the only tool. It must be part of a comprehensive package, but it's one of the most important. Contact tracing has long been the bedrock of outbreak response, from smallpox to polio to Ebola and COVID-19. One of the lessons from the recent Ebola outbreak in the Eastern Democratic Republic of the Congo, which was declared over last month, is that contact tracing can be done even in the most difficult circumstances with security problems. When Ebola was discovered in the city of Butembo last year, experts wondered whether it would be possible to bring the outbreak under control. But against all odds, the outbreak was stopped in large part because the government, WHO, and partners invested heavily in contact tracing, isolating suspected cases, and treating those that became sick. Over and over again, trained contact tracers working closely with local leaders and communities tracked the virus, sometimes over hundreds of miles in very difficult terrain. Ebola and COVID-19 are different viruses, but the principle is the same. No matter how bad the situation, there is always hope. With strong leadership, community engagement, and a comprehensive strategy to suppress transmission and save lives, COVID-19 can be stopped. We do not have to wait for a vaccine. We have to save lives now. Make no mistake, we must continue to accelerate vaccine research while doing more with the tools we have at hand. To talk more about the importance of contact tracing, both in the context of COVID-19 and Ebola, I'm delighted to welcome Dr. Sose Fall, WHO's Assistant Director General for Emergency Response, and Dr. Mori Keita, who is the Incident Manager coordinating WHO's fieldwork in the Democratic Republic of the Congo for the current Ebola outbreak in the west of the country. Dr. Fall and Dr. Keita, welcome. And Margaret, back to you. Thank you.
Thank you, Dr. Tedros. And as Dr. Tedros has underlined so powerfully, good contact tracing is key to stopping even a huge outbreak like this. But what is not so well understood is how it is done and why it matters so much. So Dr. Fall is now going to engage in a dialogue with me to explain exactly why. I'm going to ask the questions in English because I don't want the interpreters to have to put up with my terrible French, but Dr. Fall is kindly going to answer in French. So the first question is, so why does it really matter? Why does contact tracing matter so much?
Thank you, Margaret. Thank you, Dizzy. I'm going to speak slowly in French to allow interpreter to be able to follow me. Donc, je pense que c'est une question très...
I think it's a very important question because from the point of view of this pandemic, we are highlighting the importance of contact tracing. The aim of contact tracing is to be able to detect very rapidly the secondary cases, so those who have been contaminated by or infected by others. So looking for and following up the contacts, we have to first of all follow them and find them. This helps us to break the chain of transmission because that prevents the contacts from having time to transmit it further in the community. So it helps us to reduce the impact of the disease COVID-19. And by reducing the impact, we reduce the propagation of the cases. And if we do it in this way, we increase the chances of survival by contacting people early. Thank you.
Deuxième question.
Second question.
Can you tell us exactly how it works and what makes it successful and what are the things that make contact tracing fail? Many countries are struggling so much. What is it they need to really know how to do and what to look out for?
Il est important de comprendre.
What we need to understand that contact tracing isn't an isolated practice. It's part of the best practice for epidemiology. But if a country doesn't make the efforts and the necessary investment to have the epidemiological research, then that will cause problems. So it's part of the full quality research if we look at the contacts and then the context of the contacts, and that helps us to reduce the risks of infection. And it's helpful to map the contacts so we can see how much effort needs to be made to visit all the contacts and to be able to plan the operational elements. But on a daily basis, we need to ensure that we really spot the appearance of the illness, and that helps us with isolation and screening and checking. This is something that's been known for a long time, and as Dr. Tedros mentioned, smallpox.